This medication is used to treat arthritis of the knees by reducing pain, swelling, and joint stiffness, and helping to improve the ability to move and flex the joint. Diclofenac is known as a nonsteroidal anti-inflammatory drug, NSAID. If you are treating a chronic condition such as arthritis, ask your doctor about non-drug treatments and/or using other medications to treat your pain. The daily dosage and optimal timing for taking this medication should be discussed with your doctor. Before using Xelitral combination package, solution, and cream, make sure to read the provided medication guide and patient information leaflet. Apply the medication only on the skin as directed by your doctor, usually 40 drops for each knee 4 times daily. The dosage is based on your medical condition and response to treatment. Apply 10 drops of the medication onto the affected knee and spread it evenly around the front, back, and sides. Repeat these steps until the prescribed dose covers all surfaces of the knee. Let the medication dry for several minutes before allowing other people to touch it or wearing clothing over it. Wash your hands before and after applying the medication and avoid getting it in the eyes, nose, or mouth. Do not apply it to open wounds or infected skin, and wait at least 30 minutes after applying before showering. It's important to use this medication regularly at evenly spaced intervals to get the most benefit from it. Use the exact dose prescribed by your doctor, and do not use it more often or for longer than prescribed. Discuss the risks and benefits with your doctor or pharmacist, and remember that for certain conditions, it may take up to 2 weeks of using this drug regularly until you get the full benefit. If you are using this drug as needed, remember that pain medications work best if they are used as the first signs of pain occur. If your condition worsens, be sure to tell your doctor. Some common side effects of Xelitral combination package, solution, and cream may include skin irritation, drowsiness, dizziness, and a rise in blood pressure. It's important to monitor your blood pressure regularly and notify your doctor if it becomes high. Serious side effects may include kidney problems, symptoms of heart failure, liver disease, or a rare allergic reaction. If you experience any of these serious side effects, seek medical help right away. Remember to contact your doctor or pharmacist if you notice any other effects not listed here. If you are in the US, you can call your doctor for medical advice about side effects, or you may report them to the FDA. If you are in Canada, you can call your doctor for medical advice about side effects, or you may report them to Health Canada. Nonsteroidal anti-inflammatory drugs, including Diclofenac, may rarely increase the risk for a heart attack or stroke. This effect can happen at any time while using this drug, but is more likely if you use it for a long time. The risk may be greater in older adults or if you have heart disease or increased risk for heart disease. Do not use this drug right before or after heart bypass surgery. Also, this drug may rarely cause serious bleeding from the stomach or intestines. This side effect can occur without warning symptoms at any time while using Diclofenac. Older adults may be at higher risk for this effect. Stop using Diclofenac and get medical help right away if you notice any of the following rare but very serious side effects: stomach pain that doesn't go away, black/bloody stools, vomit that looks like coffee grounds, chest/arm pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, sudden vision changes, trouble speaking. Talk with your doctor or pharmacist about the benefits and risks of using this medication. Before using Xelitral combination package, solution, and cream, it's important to discuss any allergies you may have with your doctor or pharmacist. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so be sure to talk to your pharmacist for more details. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have asthma, liver disease, heart disease, high blood pressure, or kidney problems. Kidney problems can sometimes occur with the use of NSAID medications, including Diclofenac, so it's important to stay hydrated and monitor your urine output. This medication may cause dizziness or drowsiness, so it's important to avoid alcohol or marijuana while using it. It can also increase your risk of stomach bleeding, so it's best to limit alcohol and stop smoking while taking this medication. Additionally, this medication may make the treated area more sensitive to the sun, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and wear protective clothing when outdoors. It's also important to inform your doctor or dentist about all the products you use before having surgery. Women of childbearing age should talk with their doctor about the benefits and risks of using this medication. It is not recommended for use in pregnancy from 20 weeks until delivery, and if used between 20 and 30 weeks of pregnancy, the lowest effective dose should be used for the shortest possible time. It's also important to consult your doctor before breastfeeding while using this medication. It's important to be aware of potential drug interactions that could affect how your medications work and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Avoid starting, stopping, or changing the dosage of any medicines without your doctor's approval. Some products that may interact with Xelitral combination package, solution, and cream include aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, corticosteroids, lithium, methotrexate, and water pills, diuretics such as furosemide. This medication may also increase the risk of bleeding when used with other drugs that may also cause bleeding, such as antiplatelet drugs and blood thinners. It's important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that are similar to Diclofenac and may increase the risk of side effects if taken together. If your doctor has directed you to take low-dose aspirin to prevent heart attack or stroke, you should continue taking the aspirin unless your doctor instructs you otherwise. Always ask your doctor or pharmacist for more details. If this medication is swallowed, it can be harmful. In case of overdose with serious symptoms such as passing out or trouble breathing, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. Symptoms of overdose may include severe stomach pain, change in the amount of urine, and slow/shallow breathing. It's important not to share Xelitral combination package, solution, or cream with others. While using this medication, it's important to have regular lab and medical tests, such as blood pressure, complete blood count, and liver/kidney function tests. Make sure to keep all of your medical and lab appointments and consult your doctor for more details. In addition to taking this medication, making lifestyle changes such as weight loss if needed and doing strengthening/conditioning exercises may help improve your flexibility and joint function. For specific instructions on these lifestyle changes, consult your doctor. If you forget to take a dose of Xelitral, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take your next dose at the usual time. Do not take a double dose to make up for the missed one. It's important to store Xelitral combination package, solution and cream at room temperature and away from children and pets. Do not flush these medications down the toilet or pour them into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.